The COVID-19 pandemic has killed Americans in more ways than one. The virus itself has claimed more than 540,000 lives in the U.S. But there is also the increase in mental illness and anxiety as a result of lockdowns, shuttered schools, and unemployment. And that's resulted in a dramatic increase in suicide, especially among children. In this week's in-depth conversation, Susan Cadot moderates a panel on what can be done both now and in the future.
Thank you, Rich. Yes, projections are that there is going to be a crisis of mental health in regards to COVID and opioid use. And we have three panelists here to discuss why that is, how it's happening, and hopefully what we can do to address that issue. I'd like to introduce our panel now. We have Dr. Peter Kowalski, who is the Chief Medical Officer for NorthCare. Zach Stoikov, who is the Executive Director of Healthy Minds Policy Initiative, and Rodrigo Garcia, who is the CEO of Parkdale Treatment Center, which is just outside of Chicago. Gentlemen, thank you so much for being with us today.
Thank you. Thank you for having us.
So let's just jump right in. A recent report released in January talks about the tolls of COVID-19 and the fact that even though we're nearing the end of the pandemic, there are still worries. Rodrigo, let's start with you. What is the link between COVID and opioid addiction?
So, yeah, that's a great question. So what we're starting to see now, and we're really just kind of on the front end of the wave when we're seeing people into the treatment center or calling to ask for help, or concerned family members or administrators at the hospital concerned about their employees, their healthcare providers in particular. And the correlation that we're seeing is very reminiscent of the normal stress factors that are precipitating factors for substance use disorder and mental health problems. And those are things like stress, anxiety, and everything that is umbrellaed underneath there. Financial turmoil, worried about their job, how are they going to pay their bills. With the healthcare professionals, we're seeing something even a little more additive to that, and that's going to the front lines and facing this real pandemic day to day, worried about bringing this disease back home to their loved ones. So this untold, there's no way to prepare for in training, in the years of training that these healthcare professionals have had. How do you train for this amount of stress, this amount of mortality and morbidity that we're seeing now across the spectrum? So what we're seeing now, the wave is starting to crest now. Increased anxiety, increased stress, increased depression, increased drinking, alcoholism, substance use disorder, divorce rates are starting to creep up. So all of these things are kind of anecdotally now tied to the COVID and the pandemic and the stressors that are associated with that.
Zach, I want to come to you. What is the impact in Oklahoma in particular?
Well, that's a great question. It really will take years for the data to catch up and give us a clear indication of what COVID-19 has done to our mental health, but we know enough to know that it has been significant. It was touched on a moment ago, but financial hardship, there's a significant relationship between mental health conditions and economic hardship. We know the disruption of life routines and general anxiety have worsened mental health and addiction issues across our state, and those issues were here and have been here for a long time. So last spring, Healthy Minds Initiative researched the mental health impacts of past natural disasters and economic downturns, looking and taking cues from the 2009-2010 recession and hurricanes and earthquakes, and really showed that the impacts of those things, even after we rebuild, are in mental health long after we do rebuild. So we did predict that thousands more Oklahomans will experience COVID-related mental health issues, leading possibly to hundreds of deaths by suicide and overdoses, including opioids. We really hoped those numbers were wrong, but unfortunately, we've seen some early confirmation that they perhaps were not as wrong as we would have liked. There have been preliminary data from the CDC showing Oklahoma has seen more than a 50% increase in overdoses from synthetic opioids since the pandemic began. We know that as many as 40% of Oklahomans may have been experiencing depression or anxiety at the height of the virus, up from about 25% baseline. And there is indication that children's mental health is a particular concern. For example, recent U.S. Census Household Pulse survey data would show that about 24%, or a quarter of Oklahoma households with children, are seeing anxiety. Last fall, that's peaked about 69%. So we've seen some ebbs and flows, but we know it's significant.
Dr. Kowalski, on the subject of children, what kind of behaviors are you seeing in Oklahoma's children as regards to mental health issues during COVID?
That depends on the child's developmental age, and younger children are showing more clinginess and disturbed sleep, nightmares, poor appetite, inattentiveness, and separation difficulties. And it stems from the general disruption in their education and their physical activities and socialization. Many of the kids that I've seen are bored, and they tend to have lower levels of affect. It's like the life has kind of been sucked out of them. Mm-hmm. They show more attention seeking, and they become more dependent on parents, and they don't associate with peers. They're not meeting their friends. They're not playing outside. They're not participating in extracurricular activities, and this is going to have problems upon their return to school with re-engaging with teachers and their peers, and probably has long-term psychological effects for them. Now, the older children become anxious over the cancellation of their activities, their academic events, athletic events, and also the implications for college, the cancellation of examinations and post-high school training and job prospects. They also are showing signs of panic buying and hoarding, and they also are using the internet excessively, which lends them access to objectionable content and bullying, cyberbullying.
Why is socialization important for children?
Without socialization, you really have no path in life. You have you learn by doing. You learn what makes others tick, and you learn how to control and to also to interact with people appropriately. Especially the children who have special needs like autism, they need to have that training. And because they are lacking those resources, the parents are on their own, and that's a very difficult job.
Mr. Garcia, I understand you have your own personal experience with opioid addiction. How did that get started, and how did you deal with it?
You know, I've been a healthcare provider for 22 years. The last 16 or so of those years, I've been as an anesthesia provider, as a nurse anesthetist. So I started my career off in nursing, and, regretfully so, I was on the side of the fence where, mental health and addiction was still kind of thought at and described as a moral defect or a character flaw, or just don't use the drugs and just ask for help if you need it. Then it happened to me. I had a sports injury, a traumatic sports injury. I had surgery. I had my first prescription for an opioid, and I became physically dependent on that. A physically dependent opioid anesthesia provider is never a good combination, is never a good mix. I like to describe it like an alcoholic bartender. Those two things don't mix out very well. So my journey and my progress through that ended me up in a treatment center. One of the first things I realized when I was in the treatment center that specialized in treating professionals, highly accountable professionals, healthcare professionals, very similar to the one that we ended up opening called Parkdale. One of the things that I noticed is that my decisions and my drug use was not directly correlated to this sense of entitlement or wanting to become euphoric or experience those pleasures. It was a maladaptive attempt really to treat some underlying underdiagnosed mental health issues that I had suffered with my entire life. And that's what we're seeing. And that's why it's so strongly correlated and so very important that we look at the mental health, because those are the breadcrumbs that are going to lead us down the path to see some of these other things that are very serious and very pressing. Not to diminish mental health, but that's how you get to the addictions, and that's how you get to the suicidalities and the divorces and all of those other things. So it's so important that we catch this early on when we start to see signs and symptoms of mental health early on in childhood, as Dr. Kowalski has stated.
What do you advise to help stem the tide of this increase that is predicted to be coming?
Well, fortunately, COVID-19 has not changed the solutions to our mental health crisis. We've kind of known what to do all along. What it has done is it's changed the urgency and it's changed the opportunity. And I'll talk about that in a moment, because the opportunity is we are now experiencing, each and every one of us in our lives, mental health coming to the forefront in some way, shape, or form, whether it's just simple anxiety or whether it's something more serious. So we all have an indication that this is a real thing. It was mentioned a minute ago that it could be seen as a moral defect, which is absolutely not true, and the science would back that up. It's now at the forefront of all of our lives, and we can finally have these conversations. We can tell people it's okay to talk about this, and they kind of know that that's true now. So there's a stigma issue that is being reduced as a result of this that helps us come to some conclusions around what we need to do from a community and policy perspective. Now, from a community and policy perspective,
Yes.
we need to better connect the silos of our separate healthcare and mental health care systems. This means ensuring appropriate screening, referrals, and resources are available where people live, work, and seek healthcare. Not asking people to go to a separate institution, but going to doctor's offices, hospital settings, schools, employers. Mental health needs to be ingrained as part of the fabric of everywhere people are. There are some policy solutions here I'm happy to talk about, but these are not all policy solutions. These are community-wide solutions. It would require whole communities to band together, sharing data, best practices, resources, sharing responsibilities, saying mental health is not somebody else's responsibility. We all share responsibility for everybody in our state.
Dr. Kowalski, in that vein, what can healthcare providers do, physicians who are seeing patients? Do they kind of screen, or do they notice, or are they paying particular attention to the healthcare of their patients right now?
Oh, absolutely. We've been inundated with increased symptomatic patients. We've had a whole number of stressors, and the families themselves are more at risk because of the stresses, and that puts the child at more risk of being abused. So it doesn't just extend to mental health workers, it also extends to pediatricians and to teachers. And the need, I totally agree with the need for coordinated care and communication across the disciplines. When you have a teacher, for example, they can identify and refer, they can promote healthy behaviors, they can enhance pro-social behaviors. The pediatrician, they are in regular contact with their patients, and they can educate and identify stresses in the children and make appropriate referrals. As far as mental health, providing education is probably one of the paramount things, and being able to screen for unusual circumstances, being conscious of the current state of stress that their patients are under. And we do need to carry on ongoing research about the impact of this on children and later on in life.
Is there survivor's guilt going on here in the middle of this, Dr. Kowalski?
Oh, I believe so. In fact, what you have are people that have had family members that have died from it. You have healthcare workers who have observed it. You have people who have had vicarious exposure, such as medical examiners, journalists, and they've been exposed to these aversive details. And so there's definitely an overlay of trauma. In fact, you could consider this whole pandemic as a traumatic event.
Mr. Garcia, as we see people trying to cope with the pressures, the financial pressures alone, not to mention the fear of getting sick, what do you think can be done? Do you think we're seeing a light at the end of the tunnel now with the vaccines, or do you think more needs to be done to help everyone cope?
So I'll take kind of a page out of the history book here, and we kind of see this playing out over again. It wasn't that long ago where we saw the tragic events of the 9/11 and what happened there, and we're seeing that kind of unfold almost step by step on this forum, on this stage now. So the tragic events happened, and then the first responders were hailed and exalted as heroes as they were, rushing into the front lines. When we start to get back to normal a year after 9/11, and the focus was not on those first responders anymore, that's the time that we saw depression, anxiety, suicidality, depression, alcoholism, addictions, all completely on the rise. And we're going to see that again if we don't learn from history as well. We're starting to get back into what we would classify as a normal way of living again. And it's going to be imperative that as a society and as neighbors and as family members, that we don't take that spotlight off of the people that have been traumatized the most over this past year and a half. Those that have been treating loved ones, those that have experienced the COVID, those that have lost someone from the pandemic. And as long as we don't take that spotlight off and we continue to increase access to care, we continue to give a forum to be able to talk about this, raise your hand, ask for help, unbiased and unjudged, then we can start to tackle this pandemic, the silent pandemic of mental health issues as well.
And there's got to be, as I was thinking of, a member of our news team had to watch his mother pass from COVID on his phone in the hospital parking lot because you can't be with them. And man, that really got my attention. So it's more than just grief of losing a loved one. It's the way we're losing our loved ones that adds an extra trauma to that experience. Is there a spot or a website that you think people can go to? Where can they go to look for help, to begin looking?
So we have worked with a lot of different partners in the industry, and there's a website called supportthefront.com, and it's a resource allocation kind of hub for as many resources as we can provide, free services and counseling and therapy and advice how to navigate through this crisis.
Dr. Kowalski, would you advise folks to let their doctors know if they're dealing with extra stress?
Oh, absolutely. Those who are related, family and friends, check in with your loved ones. Look for increased irritability, substance and alcohol use, a decrease in their performance at work or school, or poor hygiene, especially if they just complain of feeling down or depressed, or even talk about that life's not worth living anymore, or that if they're talking about dying or even of suicide. That's a red flag that needs to be addressed immediately.
Wonderful. Thank you to all three of you for joining us.
Thank you.
Thank you.